We continue with application of psychoanalysis to DSM-5. Today we'll take up one disorder from 3 chapters: depression, anxiety, and personality disorders. And we'll apply psychoanalysis to see how we can have an alternative explanation to the disorder in terms of causality. So let us say we first talk of depression. So what was Freud's idea of depression overall before we go into each symptom? Do you recollect? Freud had a very complicated explanation for depression.
Anger turned inwards is what he said.
Correct. And that he mentioned in a specific context of an ambivalent narcissistic relationship. That you have a very narcissistic relationship, very fused relationship with somebody, and that has ambivalence. Meaning you have love and anger, love and hatred towards the same person. Usually what we call contrary feelings or opposite kind of feelings you have towards the same person. So now when that person is gone, there is a vacuum. And the normal course of events is we substitute people when there is a vacuum. If one friend leaves us, after some time we develop a new friendship. And if we were spending 5 to 7 evening every day with friend X who is no longer with us, then we spend the same evening with friend Y. So when one attachment is lost, we substitute with a different attachment. But because the relationship was ambivalent, narcissistic, and extremely strongly connected, the substitution is not possible. And because the substitution is not possible, the only way the mind can deal with it is to make the lost object one's own. So because the loss is unbearable, the only way the mind can deal with it is to make the lost object one's own, which is to take that object, put it inside oneself. But in that process, what happens is feelings towards the object now are feelings towards us because that object is inside of us. And this was Freud's explanation. In technical language, he said, loss of ambivalently cathected narcissistic object, which leads to anger turning inwards, which leads to depression. Now let us look at other competing explanations of depression later when we do each of the schools, because every school has its own way of looking at depression. But let us go with whatever we have covered till now, and we'll come again to this thing when we do another school to see how other school looks at it very differently. So let us continue with what we have done till now, one by one. Let us say the first feature: depressed mood most of the day, nearly every day. Feels sad, empty, hopeless. So we will have to bring about the concept of buckets. A general concept, not a Freudian concept, but a general psychological concept. The idea is that imagine inside of you, metaphorically speaking, there are buckets in the mind. One bucket to contain anger, one bucket to contain sadness, one bucket to contain guilt, one bucket to contain shame, one bucket to contain hopelessness. Similarly, happiness, positive and negative, both emotions. Now, two different people will have different types of buckets, different capacity of buckets. And for the same person, the capacity will be different for different affects. It's not necessary that your capability to contain guilt should be the same as the capacity to contain anxiety. Now, what happens is every time sadness is generated, part of it may be expressed or not expressed at all based upon the circumstances of the person. But even if it is expressed, part of it is expressed, part of it is sublimated, part of it is repressed, and that part which cannot be handled in any way, it overflows into symptom. So we say that when the buckets are empty and sadness is generated, you can still store the sadness. You will feel bad, but it will not create depressive features. But once the bucket is full, even one drop of sadness will overflow the bucket, and that will create a symptom. So what buckets are overflowing here? We see the person feels sad. It just does not go away. This is not grief, which will undergo a phenomena of erosion. Most emotions undergo a phenomena of erosion, natural erosion, that every day we feel everything. We feel sadness, we feel anger, we feel anxiety every day, but it does not convert into a DSM kind of diagnosis. Because if we feel anger, after some time it subsides on its own. There is a natural erosion. For many reasons. One, we are able to express. Second, it is a natural, there is a natural health maintaining system in the mind which helps in natural erosion. Part of it goes repressed in the memory, but we are free from it in some time. But when buckets are overflowing, then we can't be free. That is where this enduring symptoms come up. So we feel the person is feeling sad, which means the bucket of sadness is overflowing. And the last precipitating event of sadness is not the only event. That was the last event. It's the last straw on the camel's back. It was the last drop in an already full bucket. But the bucket has got full because of a series of events. Now, can there be an event which on a single basis can be so much sadness generating that buckets can overflow from a single event? Yes, there can be. For example, death of somebody. A single event can make the bucket overflow, but usually it's a series of events. Then he feels empty. Why does he feel empty? Anyone? Why do we feel lonely and empty?
Your object is lost.
Correct. Object is lost. Second, we are not able to substitute the object. We are not able to attach to any other object. So as I say, at one level, loneliness is a choice. So we'll come to the difference of loneliness and emptiness. But in one level, loneliness is a choice because we live in a city of more than 1 million people. And there the difference is between isolation and loneliness. Isolation means physically you can't meet people. For example, you are locked up in a locker room, say prison hall, or in a mental asylum, or in your own room for some reason. That is isolation. You cannot meet anybody even if you want to. But loneliness is different. Loneliness is you are in the middle of everybody and yet you feel lonely. So isolation is physical, objective. Loneliness is inward and subjective. And that is because you have been so thoroughly disappointed by people that you refuse to attach to anybody now. So at one level, it's a choice. That repeated disappointments have got you to a state where you refuse to attach to anybody. And you prefer being lonely than to endure the difficulties of attachment. So for you, you have come to a state where the choice is between bad and worse. You don't have a choice between good and bad. And between the two, you choose whatever you feel is less difficult. So that is loneliness. Emptiness is partly it can be that an object is lost and we are not able to find a substitute. That is one emptiness. Second is, in early life, when objects should have been internalized, they were not internalized. And therefore, the capacity to internalize objects is low. And that also can lead to emptiness. That even if you are married, you have children, everything, You are attached also, but still somewhere you feel empty inside. That is because right from childhood, it has never been filled up, it has been covered up. You have escaped from it. But that emptiness is there in the sense there is some early life experience of emptiness does not go away. Second, the capacity to internalize objects is not there or not developed or defended against by defenses, and therefore you refuse to internalize as many people as is necessary for you, and therefore you feel empty. So that is how the second feature comes up, that he feels empty, meaning he has undergone losses. Now, every depressed person will not feel empty. There may be a group of people who just feel sad. There will be another group of people who just feel angry. Third group of people who feel irritation and anger. Fourth group which feels just angry and hopeless. Fifth group which feels sad, hopeless, angry and guilty. So we'll have different groups of people within that broad area of depression. And each thing that they feel has a psychoanalytic underpinning. So he is feeling empty because he may be feeling this right from childhood. Either because objects were not available to be internalized, or the capacity to internalize was not there. Or he just could not develop that capacity because of some very difficult thing in the environment. Hopelessness. Now, this can be in two different contexts, objective and subjective. In objective area, it may just be that one has unfortunately fallen into something and there seems to be no way out of it. For example, somebody is trying to become a chartered accountant. He gives the entrance exam fifth time and he again fails. And he knows there is no more hope now. And he feels extremely sad and depressed that I have put in 3 years of preparation and now I just have to give up. And in the same time, my colleagues have cleared the exam, they have become CAs, or those who did not, they went to jobs and they are earning so much. And now I am without a job, without a degree, without a hope. It's objective. So the hopelessness can be because of objective reason. Subjectively, it may be the line of disappointment and resignation. Meaning, you try to relate to people, the person disappoints you, again you try, again you are disappointed. After a couple of disappointments, you just give in. And that is where resignation comes in. That you just say, I am done, no more of it. So repeated disappointment leading to resignation, that can be a subjective situation of hopelessness. So if we ask ourselves, what can be below this hopelessness? Why is the patient reporting this? This may be any of the reasons. He appears irritable. Why? Because the buckets of irritation and anger are overflowing. And when they are emptied out, the same person no longer is irritable, and he does not get irritated or angry at the same thing which he seems again when he is out of depression. And when we say out of depression, we will say the buckets have got emptied out in some way, either by self-work, by therapy, or maybe by medication. We don't know how, but some way the buckets have been emptied out. Any question on the first feature?
It is. I can get to read it in your notes, sir, on the presentation somehow. Again, if I want to visit this again.
I'll upload the video.
Thank you, sir.
All the videos I'm uploading. Same.
Yes, sir.
Second one, markedly diminished interest in or pleasure in all or almost all activities of the day, nearly every day. Why this should happen? Because desires have been so thoroughly frustrated, and one is so deeply disappointed that one doesn't even want to try. Till you are ready to try, you won't have this kind of major depression. So deep disappointment and hopelessness are by and large present in most cases of major depressive disorder. We are dealing with MDD, major depressive disorder. Third, significant weight loss when not dieting or weight gain. Why does this happen? It may happen because of medication. It may happen because of some metabolic change. It may happen because of diet changes. Now, diet changes we can go into. If anger, if you have sadness driven depression, the chances will be that the weight loss will be there and the appetite loss will be there. If you have anger driven depression, then the more chances are you will have weight gain and too much of eating. Similarly, for sleep, if you have aggression driven depression, anger driven depression, that what is bottled up inside is really anger, then you will have sleep on the lower side. He won't be able to sleep. He will sleep at 1 o'clock, 2 o'clock, and then wake up very early. So anger driven depression will lead to usually less of sleep, lack of sleep. And sadness driven depression will lead to too much of sleep.
But weight loss.
Yeah. Same with diet, that if it is sadness driven, usually there will be weight loss, diet, appetite loss, low diet and weight loss. And if it is anger, it can go anywhere, but usually it goes into high diet, low sleep and gain of weight. Now, the emptiness is very important. If emptiness comes in either of the two combinations, sadness with emptiness, anger with emptiness, then in order to fill up the emptiness, you keep eating a lot. And when you have major depressive disorder, along with a personality disorder, we should always check emptiness. Because in most personality disorders, we do find emptiness and catastrophic thinking, idealization, de-idealization, very common features of personality disorder. So when you have episodic MDD and underlying personality disorder, you should always check for emptiness. This emptiness is filled up by lot of eating. So excessive diet can also happen because of emptiness. And in that, you will feel lot of, if it is only emptiness, the person will fill up with anything. But if it is emptiness and sadness, which usually it is, only emptiness will be more in borderline rather than in MDD. So in MDD, we will have a huge amount of sadness as well as emptiness. So if it is sadness and emptiness, then he will not just fill it, but he will fill it with sweet things. The sweetness is to encounter the sadness. And if it is anger and emptiness, then it can go anywhere. Mostly people go for, at least the people I see, they consume a lot of food if they do, and they go for a lot of spicy things. They order a lot from online things. So emptiness is filled up by food. Similarly, there is another element here. Okay, we'll come to it. Next one, insomnia or hypersomnia, what we discussed. Insomnia or hypersomnia. Now, hypersomnia usually because of sadness, insomnia usually because of anger. Now, anger can be accompanied by guilt. And this is where the repetition of thoughts in insomnia becomes important. That person is not able to sleep, that is correct. So we move from sadness to anger. But then what is the content of thoughts which is repeated? So the content of thoughts which are repeated, they can either be of anger towards somebody, which means he wants to take revenge, he is not able to take revenge. And therefore, it is anger-driven repetition. Second, you can be self-evaluative in that repetition, that you keep repeating the thoughts that why did I do this? I should not have done this. Only if I could have done something else, which means along with anger, guilt has come in. So there we have a picture of insomnia because of anger and guilt both. Because the content of thought tells us that there is a continuous self-evaluation, self-punishment, self-criticism which is going on. So the self-criticism of depression is largely because of guilt. Now, this guilt is very important. We'll come to it just a moment. Now, psychomotor agitation and or retardation. Subjective feelings of restlessness or being slowed down. So let us go into each of them. Psychomotor agitation. When do we see psychomotor agitation? Which affects are in play?
Anxiety and restlessness.
Anxiety and anger. Yeah, restlessness, right? Restlessness is the state in which these two feelings are. These two feelings create that state of restlessness, which when it becomes too acute, we call it PMA, psychomotor agitation. So psychomotor agitation can be because of anger. It can be because of anxiety. Right? Now here, usually we will be dealing with anger. That there is anger rearing to go. Like when you become very angry, the body starts shaking. That can be one reason for psychomotor agitation. Second can be anxiety. Now, what will be the anxiety like? We talked of two kinds of anxieties: anticipatory anxiety and signal anxiety. Which anxiety is more likely here? Are you recollecting the two kinds of anxieties? The concept of it? Okay.
Sorry.
Okay. So anticipatory anxiety is related to something that will occur, something negative event will happen. Like I give an exam and I'm afraid of the result. I go to meet somebody, but I feel that he will insult me, he will scold me. So I am anticipating a negative event and therefore I am anxious. I go to stock market and I feel I'm going to lose money. Right? So all these are anticipatory anxieties: losing money, feeling humiliated, meeting somebody where you don't think the meeting will go your way, trying to do something where you fear that you will fail. You take up a case and you feel 80% chances I won't be able to solve it. So these are instances of anticipatory anxiety, that some event which is going to produce negative results for you will happen. Anticipatory. Second is signal anxiety. Signal meaning difficult feelings are coming up and the mind gets afraid of it, that these difficult feelings are coming up. So in order to pre-warn rest of the system, it creates a layer of anxiety over it. So as this thing goes up, first the anxiety goes up and wants the system to get ready because difficult emotions are coming. So it is a signal anxiety. It is giving a signal to the rest of the system to be prepared for very difficult emotions coming up. So when we talk of this symptom, psychomotor agitation, right? This can be because of anger or it can be because of anxiety. And in anxiety, this will largely be because of signal anxiety, not anticipatory anxiety. This is different from psychomotor agitation in panic, which is largely because of anticipatory anxiety. It can be because of signal also, but usually it is anticipatory. Right? So what are we dealing? And what is the difference in the two? How will we deal it? when we try to work with anticipatory anxiety, cognitive work can give very good results. But when we are working with signal anxiety, there is no point of working with anxiety. We have to work with underlying emotions. Because unless they are emptied out, the anxiety is not going to go. So however we may do cognitive work with that anxiety, what we need is release of those repressed, bottled up emotions. And this is where many times we go wrong. That we think of signal anxiety problem as an anxiety problem, when in fact it is the repressed affect problem. So there, cognitive work with anxiety is unlikely to give good results, but work on release of bottled up emotions, which are below that signal anxiety, they give very good results. Now, what will the signal anxiety be here for? What it will provide signal against? In this case of MDD, what will signal anxiety be covering up?
Evaluation.
Anger and guilt. It can cover sadness also. So either anger, sadness, or guilt try to come up, and this is a layer that is on top of it. It is the anxiety is created to cover up this upward movement of anger, guilt, or sadness. And usually it is anger and guilt more than sadness. So this can also lead to psychomotor agitation. Opposite of it, retardation. How can we explain retardation psychologically speaking?
Hopelessness.
Correct. Hopelessness and sadness, they can take away all our motivation. So the energy just is generated very low. That can be situation one. That because of hopelessness, we just don't activate the whole mechanism of desire to do anything. It's like desire takes a voluntary retirement. It's a VRS scheme. That because of repeated failure, disappointment, and resignation, the desire takes a VRS. And when desire takes a VRS, the whole system just gives up. So we just don't generate that kind of energy and we feel retarded. One situation. Second situation. So this is hopelessness situation. Second situation, too much of sadness. So bottled up sadness and anger, they are like psychological black holes. They consume all the energy inside. So whenever there is too much of sadness or anger inside, these are like energy black holes in the mind. They absorb all the energy, and therefore the person looks tired, listless, without any motivation, unable to move. Some people go to such levels that they find it difficult even to come to the therapy room or even go to the clinic. It is so deep. The disappointment, the hopelessness is so deep. The sadness and anger are so heavy. So retardation can be because of one, hopelessness, extreme hopelessness, where energy is just not generated. Second, energy is generated, but these black holes of sadness and anger are eating away that energy. And this again usually has some sort of relation to diet and weight. For example, let us say the diet is low and energy is being eaten away on top of it by sadness, then the weight loss will happen even more. If the anger component exceeds that of sadness and there is emptiness also in the person will overeat. So then what will happen is whatever extra energy sadness and anger and guilt are consuming, more than that is generated because of overeating. So high weight is put up, and occasionally you can see psychomotor agitation. So retardation can be because of extreme hopelessness, 1. 2, sadness eating away all the energy. 3, anger eating away all the energy. 4, combination of any of this eating away all the energy, anger and sadness. 5th, guilt punishing you that you deserve to be depressed, you don't deserve to get well. Can you think of some examples where guilt perpetuates depression?
I remember a patient with psychotic illness whom I had seen in mental hospital. When Indira Gandhi, our prime minister, she died, he believed that it was because he did something, and that guilt was there.
Correct. So you can have extremely high guilt, which tells you that you have done something very wrong and you deserve to suffer, and therefore you deserve to be depressed. And that guilt can also consume a lot of energy inside, leading to retardation. Let me give another example. Let us say there is a young girl, right, who has come out of the college after her PG, got married, and within 5 years the husband died. So the girl is just 30, 32, and the husband died. Now she went depressed, and then in therapy it came up that whenever she would come out of depression and feel good, after some time she would have a realization that her husband has died just a few months back. How can you be so happy now? What kind of person are you? Don't you have any sense of shame or something? So then she would again go depressed. So the guilt was perpetuating the depression that your suffering is not enough. The atonement is not enough. You still have to atone. Okay? You have to undergo depression far more and suffer. And only when it's enough, then you can come out of it. So every time she comes out of it, the guilt pushes her back into depression. So this is one kind of guilt which, along with other things, anger, can lead to retardation. It can also lead to perpetuation of depression. And this is something to be worked at, that many people feel guilty if they were to cure their depression. So often we have to work first with guilt, that don't feel guilty if you get healthy and come out of depression. So this is also true in one group of patients, that the moment they start feeling well, suddenly at some point in time, they are very happy. They are normal, they are playful, and it comes to them, how can I be happy? How can I not be depressed? And they again go back to depression. So this can be because of retardation. Now, there can be guilt also because of another feature, which is guilt related to our own anger. For example, one may have very brutal anger towards somebody. Let us say you have anger towards the father or towards the mother. It has built up over a long period of time. And at some point, after some years, you go depressed because the buckets are overflowing and there's no way you can empty those buckets. That because of reality, morality, you cannot express anger towards the parents, and you are too ethical to displace it onto somebody else. Most people escape this by displacing it on somebody else. And that's a social phenomena, that you displace it on somebody lower in the social hierarchy than you. We see that even on petrol pumps, people fight with the petrol pump attendant for no reason, and they let out their anger. It's a displacement. That because you cannot express the anger where it belongs to, you find an innocent victim. You actually create victim out of an innocent person by displacement. But that person is traumatized, but you escape the depression. But if you are ethically very strong, then you won't do displacement, and then the buckets will overflow. It cannot be emptied out. And what will happen is that anger is overflowing, and now guilt is created as to why I can have such anger towards my parents. So one problem leads to the second problem. So now we have to solve both. And when we ask the patients to feel the anger, they feel extremely guilty at times if they have to feel that anger. And often after the session, they go depressed because there is an attack of guilt. So this is also very important in therapy, that when you are asking the person to feel anger, always check in the next session or phone him up or tell him in the session, okay, after the session, if you feel down, just let me know. This is what I call the post-session depression. That if good work has been done and anger has been released, then after the session, the person feels guilty. Not everybody, some do. Right? So there can be a guilt related to existence of our anger, and there can be guilt related to the fantasies the anger creates. That if you are very angry with somebody, there will be fantasies of revenge. And these fantasies will be very brutal. And this brutality is unacceptable to our own superego. That how can I have such brutal fantasies towards somebody? And that creates guilt. That how can I have so much anger, not only anger, but such brutal fantasies. So this gets into what we call in ISTDP, the murderous rage and the torturous rage. Two types of rage. The murderous rage is the desire to kill, and the torturous rage is to torture somebody to death, not kill him easily. So when this happens in the unconscious mind, guilt arises. So in such situations, what you will have is the person holding on to the anger because he feels too guilty to let it go, even in therapy. So in therapy, when sadness and anger don't flow, we first have to work with the resistance to the flow and then work on the core feelings. So this retardation may also be because of anger guilt combo, right, related to it. It can also be because of catastrophic fear of anything happening. Like a depressed person does not want anything to happen around him. He wants everything to be silent, dead. Any activity can create catastrophic anxiety in him. So he prefers the peace of the graveyard to the hustle and bustle of everyday life, because that is catastrophically anxiety provoking. And it also has to go into energy dynamics, that the moment in order to attend to those events, energy rises. That energy, that energy also fuels the sadness and anger inside, irritation inside. So he wants to remain in that low energy equilibrium, the peace of the graveyard kind of situation. Because any rise in energy will not only create catastrophic anxiety of more anger and sadness, but they will power up those anger and sadness also because of higher overall energy. Yes, please.
Can I ask something? I'm sorry, it may be confusing or maybe not related. When you see patients of sexual abuse, the victim often feels guilty for no reason, actually. And then if during the course of therapy or something, and we are uh, able to let the patient come up to reporting the incident, then after that they feel fear that the perpetrator will harm them back.
Correct.
So it is depression, anger, and fear again.
Correct. So yeah. So
yeah, this is very complex.
That is complex because one is there is guilt and shame. First is the shame, how to tell this to somebody, even to the therapist. It's so shameful to say these things. Once you overcome that, then there is guilt that I must have done something to bring this upon me. Right? So it's very difficult for them to accept that they were innocent victims and they did not have a responsibility in bringing it upon them. Second. The third is, it is used as a defense against anger. That if I tell myself that I am guilty, then the other is absolved of his guilt, and then there is no reason to feel angry towards him because he's not guilty at all. But if I don't make myself guilty, then I have to apportion the guilt to the other, the perpetrator, and then that murderous rage and the torturous rage will flow, and I'm terrified of that flow inside of me.
And after the anger, if they feel afraid of the perpetrator harming them back,
Correct.
then do we say that the cycle changes from depression to paranoia?
Yes, because there what happens is the mechanism is of idealization and de-idealization. That they feel that they are like a completely powerless child and the other is omnipotent. So if the other comes to attack, right, all they have to do is to bear the torture till death. There is no escape and there is no retaliation. They can't even think of resisting the person. So there we have to deal with idealization, de-idealization. Yes.
Can we not somehow change this and let them feel anger and not feel afraid later?
Correct. Correct. So when we ask them to feel anger, one of the resistances will be the omnipotence of the other. So we have to tell them ki don't worry about it. And this may require a cognitive discussion first. Right? That what happens is that you are getting into the phenomena of idealization, de-idealization. That you are not feeling that you are a person of 35 years of age. You are feeling you are a neonatal, completely powerless and helpless, and the other is omnipotent. And neither of that is true. Both of these are fantasies. That you are in grip of fantasies.
Yeah. And de-idealization is the same as devaluation, or it is different?
Same. It is like तुम गगन के चंद्रमा हो मैं धरा की धूल हूं. Right? So everything it is, and then we go in deeper. When we go into the de-idealization, we come to the problem of owning up the good in oneself. That why is it so difficult to own good in oneself? Because obviously there cannot be any person without any good in himself. So then we come to this, that not owning up good in oneself is actually used as a defense against losing an attachment figure. That the attachment figure is such that if I own up goodness in myself, the attachment figure will not like it. And if I own up goodness in myself, and if I assess the attachment figure also very judiciously, I will have to see that there are faults in him. And this will do two things. The attachment figure will not like it, so he will create more distance. Two, I will lose an omnipotent figure, so I will lose the ecstasy of omnipotence, because it's also ecstatic. One of the reasons why we do idealization, de-idealization is that when we are with the person we idealize, we feel that ecstasy, very high happiness. And the third is, if I be realistic, anger will flow towards the attachment figure. And then attack or loss will happen, which is terrible for me. So these are the reasons why I don't allow myself to own up the good in me. And later in life, what happens is, once this template is in place, then even if it is not the attachment figure, the template repeats itself. So the primary thing is, how do I own up the good in myself? That is the action point. And there are some tools of owning up the goodness in oneself that one can just write down on a chart paper and put it in his room and tell oneself that these are the claims that I am good enough, and these are backed by evidences in reality. It is not just my opinion of myself. Like, I have done MBBS, this is the evidence in reality. I have done MD, it's an evidence in reality. So then the struggle, conflict inside becomes that there is evidence in reality and there is an unconscious motivation. Both are in clash. And one has to observe the clash and be on the side of evidence in reality. Now, this is typically what happens in dependent personality disorder. But it can happen, and this can happen very much where a person comes into a major depression and also has a dependent personality disorder. And there, this phenomena,
Conflict is between evidence in reality and
my
clash.
unconscious need to maintain I am not good enough. Evidence in reality says I am good enough, but there is an unconscious need to maintain I am not good enough. So then we go into, as we did a few minutes back, we go into reasons. Okay, why am I maintaining I am not good enough so strongly? What are the reasons for it? What am I getting out of it? There must be some reasons for maintaining it so strongly. So when we go into those reasons, which we just went in a few minutes back, then slowly after a few sessions, when it repeats over and over again, it starts sinking in, and then the change happens.
Thank you, sir.
Thank you. We come exactly to this feeling of worthlessness. So it may be because one has failed and that sample event has got generalized onto oneself completely. That because of that failure, a lot of sadness is generated, anger is generated. That may be one reason of worthlessness. Second, it may be that I have a lot of anger towards somebody, and because of that, I am depressed, and I am using this feeling of worthlessness to cover up that anger. So this worthlessness may be a defense, that I'm using that to cover up the anger so that it does not go where it belongs to, because that may produce very difficult results in reality. Third can be what Freud said, that you have lost a strongly attached figure, a strongly attached to figure. And now what has happened is you have internalized that person because you could not deal with loss in any other way. So now all feelings towards him are now towards you. So if you thought he was worthless, you start telling you are worthless. Right? So we often see patients of depression going into this rumination. They again and again say the same thing. I am good for nothing. I am worthless. What else could happen to me? This was to happen to me. This is what I deserve. And if you tell them that evidence in reality is something else, they will get angry at you. They don't want evidence in reality. Because they are not saying this to themselves, they are saying this to that person they have lost. So a person who has lost his father and he says, I am worthless, is telling his father, you are worthless. And after adequate catharsis happens, this stops. Excessive or inappropriate guilt. So it may be because one has done something wrong, because of which some loss happened, sadness happened, and one went depressed, one route. It may be because one is guilty for not performing to the standard of oneself and angry at oneself, and therefore this condition. Third situation, one is guilty because of having that kind of rage towards somebody, and therefore the guilt. Fourth situation, one has internalized somebody who should have felt guilty, and now you are feeling that guilt for him. So these are the roots to the seventh feature of depression: feeling of worthlessness or inappropriate guilt. So again, I'll repeat the guilt part. You can feel guilty because you have done something which has brought upon heavy loss that took you into sadness, and therefore you are depressed and guilty. Like losing money. You are angry at yourself that why did I put everything in the stock market? Second guilt can be, I internalized somebody who was guilty because of something that I know he was guilty of. And now I feel the same thing because I have internalized him. Third, I have rage towards somebody and I feel guilty that I have rage towards somebody. Fourth is there can be activation of earlier childhood complexes along with an adult event related situation. That I am very, very angry at my boss, I cannot express, so I go depressed. At the same time, I feel guilty of having brutal revenge fantasies towards him. At the same time, it also evokes my Oedipus. And the Oedipal guilt now joins in. So this is Vandya, please.
I have some doubt here.
Huh.
I may be falling short, I don't know. I believe that sometimes, many times, we see patients these days who do not feel guilt even after experiencing a lot of hatred toward the other person. It may be the boss, maybe the parent figure, and the brutality of the emotion, experienced emotion continues.
Right.
Is that wrong, or is some therapeutic work falling short?
There are three different reasons for it.
Uh-huh.
One is there is a general deficiency in the superego development
Uh-huh.
that we see now more than before. So
Okay.
what we call in psychotherapy as superego pathology.
Uh-huh.
That the superego is too harsh or too lenient. Too lenient means perversion, right? And even more lenient means sociopathy, and absent means psychopathy. That's a spectrum of that ego being weak kind of thing. And on the other side, if the ego is very harsh, then the problems of guilt come up. Now, what we are looking at is the situation that we are seeing is one, the superego is no longer as strong as before. For example, pre-1947 generation, our fathers, it was a superego generation. If you look at ego superego, very strong superego. What has to be done, come what may. Now, our generation was slightly less harsh superego. We were more of an ego generation. And now we have the id generation. So they don't have that kind of taboos that we have. So it's generational. So that is one component, that there is a generational cultural shift in the relative strength of the superego across generations. That is one. Second is, we may also be looking at some of the sociopathy, psychopathy kind of things. And the third is, we may be looking at extremely narcissistic people. And that's a very important thing, that narcissism has gone up many times because of the way children are brought up in the last 20-30 years. Narcissism has been a pandemic now. It's a pandemic almost. And lastly, we may be dealing with split open. Now, we'll do it when we do Klein, but just take a note of it that there may be a situation of the split open. What it is, I'll go later into. But if the split is open, then one may not feel guilt. And the second corollary is, even after experiencing release of anger, one may not get the healing.
Yes, sir.
So this is very important, that when we do affect release, it has to be not in the condition of an open split. Otherwise, the gains are very low. Delusional guilt, meaning the kind of guilt we are referring to in terms of the Oedipus, that if it comes from the unconscious, there's nothing in the outer world to justify it, and from a DSM standpoint, we look at it as delusional. Because we don't find any outer world cause for it. But in psychoanalytic terms, we won't find it delusional. We will say it's coming out from early life unconscious event. So from DSM standpoint, it's delusional. Psychoanalytic standpoint, it's not delusional. Okay. Diminished ability to think or concentrate, or indecisiveness nearly every day. So one, it is the problem of motivation because of hopelessness. Second, it is a problem of energy because all the energy is taken up by the repressed anger and sadness usually. At times guilt, but usually anger and sadness. Third is anxiety, which covers up the anger and sadness, and the anxiety can lead to inability to think clearly. That signal anxiety can go anywhere. Like the signal anxiety may just produce palpitation. It may just produce fidgeting of hands and legs. It may just produce nauseating feelings. That one feels very nauseating as one is depressed. It's because the anxiety, the signal anxiety is going into the smooth muscles of the stomach and producing the nauseating feeling. So whenever a patient reports nauseating feelings, always check signal anxiety and always check emotions below that signal anxiety. Yeah. Occasionally, hands and legs can go completely loose. The muscles will lose their tone. That also is an anxiety symptom. Occasionally, one cannot think clearly. So there we say the signal anxiety is going into the cerebral perceptual apparatus, the cognitive perceptual apparatus. So when the anxiety is very high, it will go into the cognitive perceptual apparatus, and either you will have blurred vision, the vision occasionally goes blurred, or you cannot think clearly, or there is a fog in the mind, or you just go numb. You just can't think anything. Like many people say, I prepared very well, went to the examination and just went blank. That's because of the surge of anxiety. And that goes into the cognitive perceptual apparatus and creates this blankness. So below the blankness, it's not a neurological problem, it's an anxiety problem. Often we treat it wrongly, that because the mind goes blank, we feel there is a neurological thing. Often it's anxiety, only anxiety. Even fainting can be only anxiety. Like one of my patients, he used to faint in the therapy room. So I used to sit with a glass of water and sprinkle on his face 3 times, 4 times in the session, and then he would again wake up and then go ahead for 4 or 5 minutes. But fortunately, over a period of time, we could get over it. And now he's doing fine. But you can have fainting because of anxiety. And this is a point where our narcissism helps. That without doing any investigation, we conclude that this is because of anxiety. This is what I did out of my narcissism without any investigation, any opinion from neurologist. I concluded on my own, which was a stupid thing to do, but it worked out. Anyway, they had done all the reports before. So even if I did not do it, They had done it before. Huh.
There was a novel called White Hotel.
A novel called?
White Hotel.
Say it again.
White Hotel.
Ha ha ha.
In which it is based on some lady who got arrested during the Nazi regime and all that. And it was really, I'm sorry, I don't remember the detail, but after death, she goes into the heaven and then she meets Freud and
Acha.
Jung and all those things. And uh, it was wherever, like cryptic clues and coffee time clues. All the
Acha.
pains in her body that she experienced all her life were shown to be coming true when she was hit by bullets
Oh,
toward the end of the novel. And they were all the time like they were as if cryptic clues given by
correct.
the system
Ah,
that this is going to happen in future.
correct.
I will find out if I can locate that novel.
So this, from our point of view, this falls into the area of unconscious related to what is called precognition.
Uh-huh.
That can you know the future? And very good experiments have been done in this area by CIA, the American agency, during the Cold War. So they used to collect people who were interested in this area, and they used to ask them, tell me when Russia is going to detonate the next atom bomb and where they are going to do. And there was a head scientist called Edward May. So the system there is that after you come out of this kind of projects, for 20 years, you cannot say anything. It's classified. And after 20 years, you are free. So after 20 years, he has written books and given interviews. And he tells us that precognition is actually possible and they could get results far more than 50% because 50% is like chance. It can just happen by fluke. But if you get 60-70% kind of results, then that is something substantial. It's statistically significant. So I'll send you the Edward May's interview. So he's dealing with this idea of the unconscious and precognition.
Yes.
And then he has also explored unconscious and retrocognition. Retro meaning knowing the past. For example, let us say a ship was sailing from UK to USA 150 years back, and the ship drowned in the Atlantic Ocean, but the ship had a lot of gold into it. Now we want to find the gold, but we don't know where it drowned. So you can get together people who are into retrocognition, finding out the past which is unknown. And both of them have to do with the unconscious. So that is what number 8 is dealing with anxiety, signal anxiety affecting the cognitive perceptual apparatus, not allowing you to think clearly. One more reason, if you have failed in something and fallen into depression, not that something has happened to you, these are two different things. Somebody dies out of old age, it has happened to you. Some accident took place and you lost something, it has happened to you. But if you have failed somewhere, then that can chip away your self-confidence, your ego strength, and that can also result in indecisiveness. Ninth one, recurrent thoughts of death, recurrent suicidal ideation. In sadness-driven depression, this may be for oneself. That early in the morning when you have to get up, the thought comes, why has this morning come again? I'll have to wake up now and go out into the world. I wish the night would go on for 1 or 2 days more, so I don't have to wake up and encounter the world. That is sadness. Suicidal thoughts of sadness-driven depression will have to do with cessation of activities, cessation of involvement, desire for going silent, that I wish I just fall silent and everything falls silent. And the suicidal ideation will not be brutal. The person will not ideate that I will go and sleep under a train, or I will take a knife and put it in myself. The mode of suicide will be more geared towards cessation of activities and will be softer. Whereas in anger-driven depression, when suicidal ideation happens, it will be anger-driven. And in fact, you choose for yourself a brutal death because this is what you want to do to somebody else. So if you get an ideation that I will stab myself 5 times and then I will put it in my throat, it means you want to stab somebody else 5 times and put it in his throat. So all the ideation towards somebody now is turning back on you. So when somebody is anger driven and he says, I want to commit suicide, actually he wants to commit murder. But because the desire for murder is stopped by reality and morality, the desire to murder turns into desire of suicide. So there we have to ask him, who do you want to kill? When you say, I want to die, what it means is I want to kill somebody, but I cannot do it. And therefore, I am doing it indirectly. I'm still killing somebody. Psychologically speaking, by killing myself, I'm actually killing somebody. By identification in the inner mind. So in anger-driven depression, the ideation will be more aggressive, more brutal. And this is what they want to do to somebody else, which being stopped by reality, morality comes back on oneself. And in therapy, we have to bring it up. Okay, when you say, I want to die, what it really means is I want to kill. So let us go into who would you like to kill? Who has hurt you so much that you want to kill him? And that opens up the thing. And once anger starts flowing to where it belongs to, the suicidal ideation goes down. So this is how we look at each of the symptoms that we say constitute depression, and what is the psychological story behind each of these symptoms. And obviously, if we want to know the psychological story, we have to ask related questions in the case history, and therefore the case history for therapy will become slightly different than case history for psychiatry, because we want story of each of the symptoms. So we have the story, life story of the person, and we have the theory knowledge of psychoanalysis. We apply the theory onto the life story, and we get the story of each of the symptoms specific to that person. Any questions?
Thank you.
Let
It was
us.
very nice.
Thank you so much.
Thank you, sir.
So this brings us to Jung's old dictum that every symptom has a story to tell. There is nothing which has just happened because of a biochemical accident.
Determinism of psychoanalysis.
So of course, there will be cases where it will be purely biochemical, but we proceed with the basis that we must find a story. And if after doing everything, nothing is found, then we say, okay, maybe purely biochemical. So let us stop for a cup of tea and come back in 10 minutes. It's 3:45. We come back at 3:55 and we go to the second part, anxiety.
Thank you, sir. Thank you.